Hello students, today we will discuss about the radial nerve. The radial nerve is also known as musculospiral nerve. Now why it is known as musculospiral nerve? Because it is having a spiral course, or you can say that it passed through a spiral groove on the posterior aspect of your humerus bone. And it is going to supply all the muscles on your dorsal side of your forearm. So it is also one of the pattern to ask the question on the radial nerve, that is musculospiral nerve. So when you will have the radial nerve, the most important thing which you have to keep in mind that radial nerve is a nerve of the posterior or extensor compartment of the arm. Now my dear students, whenever we are talking about the radial nerve supply, or if you are having any question which are related to the radial nerve palsy, you always keep in mind that you have to find out the posterior compartment or extensor compartment of your arm, forearm, or the dorsum of the hand. If you are having any question which is related to the ventral surface supply or the flexor compartment, you never think about the radial nerve. So it is the largest and thickest, the thickest branch of your brachial plexus. It is a continuation of the posterior cord. You know that posterior cord is having the two major terminal branches, axillary nerve and the radial nerve. And radial nerve is considered as a continuation of the posterior cord. Now there is a very important concept about the root value of the radial nerve, that the radial nerve is having the root value of C5 to C8 and T1. You know that whenever we are talking about the roots of the brachial plexus root starts from C5 to T1. So all the roots are contributing into the radial nerve, but my dear students, you have to understand that this nerve is conveying all the dorsal branches of ventral rami. Now this is the important part of the root value, that there are ventral branches and there are dorsal branches. So all the dorsal branches of the roots of C5 to T1 contribute into the radial nerve, and here you can keep this concept in mind that all the dorsal branches are supplying the dorsal surface of your arm and forearm. Clear? So this dorsal surface of the arm, dorsal surface of the forearm, dorsal surface of the hand is supplied by the dorsal branches of the brachial plexus, and that is your radial nerve, because radial nerve is formed by the dorsal branches of the ventral rami of C5 to T1 nerve. Clear? So that's why I am saying whenever we are having any question with the this special word, that means there is an involvement of the dorsum of your upper limb, you can think about the radial nerve. Otherwise, if you don't have these words, you cannot think about the radial nerve. So what is the beginning? When you will start the course of the radial nerve, you have to first check the origin or the beginning of this radial nerve. So radial nerve is a continuation of the posterior cord, which I already told you, and it is initially present behind the third part of axillary artery. So here you have to keep this concept in your mind that whenever we are talking about the cords, there are lateral cord, medial cord and posterior cord, and the names are given in the reference of second part of your axillary artery. But when you will have the branches, the branching starts around the third part of axillary artery. So because it is a branch of the posterior cord which is posterior to the second part of axillary artery, so it arises posterior to the third part of axillary artery. Clear? And you know that axillary artery continue as a brachial artery, so it also continue behind the upper part of brachial artery. So my dear students, its origin occurs in the lower part of the axilla, which you can appreciate in this diagram, that this is your artery. Now this artery is your axillary artery, and in this diagram you can see that this is the medial cord which is medial to the second part. This is the lateral cord which is lateral to the second part. The posterior cord is not visible because it is behind the second part, and then the branching will start in relation to the third part of axillary artery. So, which you can appreciate in this video clip, that is the beginning or the origin of your radial nerve. So, first this is your axillary artery, that is continue with the brachial artery. So, we have to remove the axillary artery for the proper understanding of the posterior cord. Here you can see this is the medial cord, this is your lateral cord, and this is your median nerve. So, we will remove this axillary artery, and once you will remove this axillary artery, the posterior side nerves are visible now, and that posterior nerve has to be your radial nerve, which comes from your posterior cord. Clear? So, this is the important thing to understand, that this is your radial nerve and the origin is not visible in the dissection because the origin is hidden by the your axillary artery. So, this nerve is going downward and then it disappears behind the humerus. Clear? So, what is the course in axilla? After the formation, the radial nerve runs behind the axillary artery, and also it lies behind the proximal part of brachial artery. So, that I already explained you. Because it is a branch of the posterior cord, it initially remained posterior to the third part of axillary artery, and the axillary artery continue as a brachial artery. So, that is why it also remain behind the proximal most portion of your brachial artery. Now, later on what will happen, that when you will see this area in the axilla, you will find that this nerve lies on the muscles which are forming the posterior axillary wall. So, in the posterior axilla, you are having the subscapularis, you are having the latissimus dorsi and teres major. So, all these three muscles, that is your posterior axillary wall muscles, are lies behind the nerve. So, here you can see that this is your subscapularis, below that you will have this teres major, and this is the latissimus dorsi, and on these three muscles you can see that this is your radial nerve. Clear? So, whenever you are doing the dissection, you will find that radial nerve is not visible because it lies behind the axillary artery. Once you will remove the axillary artery, then you can see the origin of the radial nerve, and this radial nerve lies on these three muscles, and these three muscles are subscapularis, then you will have teres major, and then you will have latissimus dorsi, and then this will go through this space, and this space is known as triangular space. When you are reading the spaces around the scapula, you will have the three spaces: upper triangular, lower triangular and quadrangular. So, through the quadrangular your axillary nerve exit, and through this triangular space you can see that this radial nerve is passing and it will disappear from this point. So, before disappearing through this triangular space, it lies on these three muscles. And what are these three muscles? Subscapularis, teres major and latissimus dorsi. Now, what is the course in the arm? Now, see, you have to understand that this nerve is not having the relation in anterior arm, because as soon as it will arise in the axilla, it goes behind the arm. It is visible in anterior arm only in the lower part near the cubital fossa, that we will see in the coming slides. So, what will happen in the arm? The radial nerve enters in the posterior compartment. So, whenever somebody will ask you what is the relation of the radial nerve in arm, now the major relation in arm is always in the dorsal side or the posterior side of the arm. So, in the posterior compartment of arm, how it enters? So, it enters through the lower triangular space. So, this is the first question, that which space is taken by the radial nerve to exit the axilla? Answer is your lower triangular space. So, through this lower triangular space, it enters into the your posterior compartment of arm. But my dear students, again there is a artery, and the artery is known as profunda brachii artery. Now, this artery always run along with the radial nerve when it is passing through the posterior side of your arm. So, through the lower compartment, lower triangular space, these two structures are passing in the posterior compartment, that is your radial nerve along with the profunda brachii artery. So here you can see that this area is the area of lower triangular space, and here the two structures are passing. So you have to keep this thing in mind that when we are having the spaces, now this is the upper triangular space, this is the your quadrangular space, and this is your lower triangular space. Now we are concerned with this lower triangular space today, and this lower triangular space bounded by the teres major above, the long head of triceps and your humerus on the lateral side. So through this space, your radial nerve exits from the axilla and enters into the posterior compartment of arm. So here the radial nerve runs downward and laterally. Now see, this direction is again important, because so many times you have this question, draw the radial groove on the dorsum or the posterior surface of your humerus. So when I am drawing the radial groove on the posterior surface of the humerus, I have to keep in mind that the direction is from your downward and laterally. So I have to go like this. Radial nerve is having the entry point here, and it will come out from this point through the this hair on the lateral end of the radial groove. So what is the direction of the groove? The groove starts from the upper part here, and it is having the exit point here. So direction is downward and laterally. So it runs in the radial groove, or it is also known as spiral groove on the dorsal surface of the humerus between the lateral head and the medial head of your triceps. So here in this diagram also you can see that we have cut these two heads. This is your medial head, this is your lateral head. When you will cut these two heads and you will separate it, you will find there is a presence of the radial groove or the spiral groove, and in this groove there is a presence of the radial nerve which is running along with the branch of your brachial artery, that is profunda brachii artery. Clear? So the important thing to understand here, that what is the direction of radial groove. So the direction of radial groove is your, this is the entry point, this is the exit point. So it is a oblique, first thing. Second thing, it is going from medial to lateral side. So the direction is downward and laterally. Clear? So this is the first and important question. Second question is that the radial groove lies between, answer is medial and lateral head of triceps. Third question is what is the content? So answer is your radial nerve and profunda brachii vessels. Now what will happen in the arm after exiting through the lower end? So my dear students, you have to keep this thing in mind that your arm is divided into the two compartments by the medial and lateral intermuscular septum, and these septums are attached on the supracondylar ridges on both the side of the humerus. So what will happen here, that this now when running in the posterior compartment will reach on this lower end here. Now it has to enter in the anterior compartment. So how to enter in the anterior compartment? It has to pierce the intermuscular septum which is present on the lateral side. So it pierces the lateral intermuscular septum. So this is the one thing, that how the radial nerve again re-enters, because it is present in the axilla here, it is visible when you are doing dissection behind the third part of axillary artery. Then it leaves this front area, it enters into the posterior side, and then it again try to enter into the front. Now here you should have this question in your mind, that why it is not piercing the intermuscular septum here? Because the intermuscular septums are not well developed in the upper part of the arm. Intermuscular septa are well developed only in the lower two-thirds of the arm, where they are attached along the supracondylar lines and the borders. As you will go in the upper part of the arm, you don't have the much well-defined intermuscular septa. So the nerve will enter through the triangular space, then it passes through your radial groove, then it is present here in the posterior compartment. Now at this point in the posterior compartment, it pierces the lateral septum to re-enter again in the front of your arm. So to enter in the anterior compartment, just in the lower part of the arm above the elbow. So just above the elbow joint, it try to enter, and how it enters? By piercing the lateral intermuscular septa. So here you can see that these are the two septas. This is the septa on the lateral side, this is the septa on the medial side, and here you can see that at this point this nerve is piercing the lateral septum, and then it is again visible here in the anterior compartment of your arm. So it lies in intermuscular space. Now this is the question of your exam, or even when you are dissecting this area, you have to find out the radial nerve near the cubital fossa. So once the nerve pierces the intermuscular septum, it comes in this area between the muscles. Now what are these muscles? So it lies in an intermuscular space between the brachioradialis and extensor carpi radialis longus laterally and the brachialis medially. So you have the brachialis muscle, which is a muscle here on the medial side, and you know that this lateral supracondylar ridge gave origin to the two muscles, brachioradialis and extensor carpi radialis longus. So the space between these two muscles is having this entry of your radial nerve into the arm. And at the front of the lateral epicondyle, it terminates into the two terminal branches, that is your superficial and deep branches of radial nerve. So now in this video clip, you can see that this is the posterior aspect where you have the triceps. Now if you will remove the triceps, what you are able to see, you will have the posterior view of intermuscular septa, and you can see this is the radial nerve present in the radial groove. At this point, now what is happening? The nerve is piercing the lateral intermuscular septum, and after piercing the lateral intermuscular septum, this nerve will go in the anterior side. So here now you can see that after passing through this septum, the nerve appears on the anterior compartment of your arm. So the nerve initially present in the posterior side in the radial groove, then it pierces the lateral intermuscular septum in the lower part, and then it comes in the anterior aspect. Now the another important thing is that how this nerve lies between the intermuscular space. So here you can see that this is your brachialis muscle. Now you know that brachialis arises from the your humerus, and it crosses the elbow joint to go into the forearm. Now here on the lateral side, you will have this lateral intermuscular septum, which is attached on the lateral border of the humerus. Now here you will have the two muscles. What are the name of these two muscles? Brachioradialis, and this is your extensor carpi radialis longus, and this is the muscle which is brachialis. Now between the brachialis and these two muscles, you will have the nerve which is known as radial nerve. So here you can find that when you are dissecting, and if I want to trace the entry of radial nerve into the front of arm, I have to dissect along this lateral border of the brachialis in lower part. So once you will remove the brachialis, now you can very well see this is your radial nerve which is entering at this point after piercing. Now here you can see that termination of your radial nerve. So radial nerve terminates here. Now you can see that this is your lateral epicondyle, and near to the lateral epicondyle, this bony projection is known as capitulum. So in front of the capitulum, it is dividing into the posterior branch and the anterior branch, or you can say this is the superficial branch and the deep branch, and these branch will later on run into the forearm. So what are the different branches? So once you are reading the course, you have to understand that the nerve arises in the axilla, then it runs in the posterior compartment of the arm, then it pierces the lateral septum, then it comes in the lower compartment of the anterior compartment of the arm in lower part, and here it lies lateral to the brachialis but medial side of your extensor carpi radialis longus and brachioradialis, and then it terminates into the two terminal branches. So what are the branches? Now when you will see the branches are divided area wise. That means the branches in the axilla, the branches in the radial groove, the branches in the lower part of the arm and the terminal branches. So, you will have the 4 sites where you will have the different branches. So, first we will see the branches in axilla. So, in axilla it is giving 2 muscular branch and 1 cutaneous branch. So, what are the muscular branches? Now, you know that there is a muscle on the posterior compartment is known as triceps. So, this is going to supply this triceps, and you know that triceps means there are 3 head. So, in axilla it is going to supply your long head of triceps and medial head of triceps. So, these are the 2 muscular branches. Now, it is having 1 cutaneous branch. Now, this cutaneous branch is known as posterior cutaneous nerve of arm for the skin on the dorsal side or the back of the arm. So, in this axillary area, now you can see that the part of this radial nerve which lies on the anterior side. Now, this is the axillary area. Now, in this axillary part, you are having the 3 branches. 2 branches for the triceps and 1 branch is for the skin. So, what are the 2 branches? Long head of triceps and medial head of triceps. Now, my dear students, the nerve which is supplying the medial head is also known as ulnar collateral nerve. Why ulnar collateral nerve? Because in this image you can see that this is your ulnar nerve. Now, this ulnar nerve here it is passing behind the medial epicondyle. So, this is your ulnar nerve. Now, one of the branch which is supplying the medial head of the triceps is sometimes longer, and this branch is running along with the ulnar nerve for the some distance, and that is why it is known as ulnar collateral nerve. So, what is ulnar collateral? The branch of the radial nerve which is running along with the ulnar nerve is known as ulnar collateral nerve. And ulnar collateral nerve word always used for the supply of medial head of triceps. So, this is a sometime question for your exam, that ulnar collateral nerve supply which head of the triceps? Answer is medial head of the triceps. And what is the ulnar collateral nerve? It is a branch of radial nerve, not ulnar nerve, and ulnar collateral nerve is known as ulnar collateral because for some distance it runs along with the ulnar nerve after taking the origin. Clear? So, in the axilla you are having the 2 muscular branch and 1 cutaneous branch. Now, when you will enter into the radial groove, that means here in this posterior area, now this is the area where you have the branches, that is the branches in the spiral groove or the radial groove. Now, here you will have the 3 muscular and 2 cutaneous. Now, what are the 3 muscular branches? Again, they are supplying the heads of your triceps, but not the all 3 heads. You have the branch for the lateral head and you have the branch for the medial head. So, my dear students, here you have to understand that the long head of triceps, what is that? Long head of triceps supplied by the branch in axilla, which you can appreciate here that it is the long head which is receiving the branch in axilla, but the lateral head is receiving the branch in spiral groove, while the medial head is having the branch in axilla also and in the radial groove also. So, this is important to understand because when you are having the radial nerve palsy, the question is related which head of the triceps is not get paralyzed. Now, some book says that this radial groove branch which is supplying the medial head is known as ulnar collateral, but most of the books accept this concept that the ulnar collateral nerve arises in the axilla, not in the radial groove. But at the end you have to keep this thing in mind that ulnar collateral nerve is a branch of radial nerve and it supplies medial head of triceps. Now, there is one more branch, that is nerve to anconeus. Now, anconeus is a very small muscle, and here you can see that this is a muscle which is present here in the posterior side. Now, this anconeus is sometimes having an independent nerve or sometimes this nerve to medial head of triceps become longer enough, and this nerve is itself, after piercing the substance of the medial head of triceps, approach this anterior, and ultimately it will terminate by supplying this elbow joint. Clear? So this is a question of your exam, that anterior is supplied by nerve to which head of triceps? Answer is medial head of triceps. So nerve to medial head of triceps sometimes becomes so long that it itself again supply the branch that is to the anterior muscle. Then there are two cutaneous nerves. One is known as lower lateral cutaneous nerve of the arm, and one is posterior cutaneous nerve of forearm. Clear? Now lower lateral cutaneous nerve of arm supply here. Upper lateral cutaneous nerve is a branch of axillary nerve, and lower lateral cutaneous nerve of the arm is a branch of radial nerve, which arises in the radial groove. So you have seen that there are total 3 cutaneous nerve. One arises in the axilla and 2 arises in the radial groove. And there are 2 muscles which are supplied by the radial nerve here. One is triceps and one is anterior. Now once it enters after piercing the lateral intermuscular septum in this lower part, what are the branches? So here it is supplying all the 3 muscles. Basically it supplies the brachioradialis. It is also giving a branch to the extensor carpi radialis longus, and it also give a small branch to the brachialis. So ultimately you will realize that brachialis is supplied by the 2 nerves. One is the musculocutaneous nerve, and second thing is it is also receiving a branch from the radial nerve. Now after that it also giving a articular branch to the elbow joint. So what is the nerve supply of triceps? So you will see that this is your radial nerve, and we have divided the course of radial nerve into the axilla and into the radial groove. So the axilla is giving the branch to the long head and to the medial head, and this part is also giving branch to the medial head and to the lateral head. So this is the important concept to understand, that the medial head of the triceps receiving the branch from 2 areas, one in axilla and one in radial groove. The long head is receiving only single branch, that is in axilla, and the lateral head is also receiving the one branch, that is in the radial groove. Clear? So suppose this nerve will get injured here. If you find that the radial nerve will compressed here in the radial groove, which head is going to affect more? So here you can see that the lateral head affected more, because lateral head is receiving the supply in the radial groove. So this is an important thing which you have to understand. Now what are the terminal branches? So terminal branches are superficial branch and the deep branch. Now there is a very important concept about the superficial branch, that superficial branch is not supply any muscle. Superficial branch is supply no muscle. It is purely supply the skin and some joints. So this is the important thing about the superficial branch. In the same way, there is one more important thing about the deep branch. That deep branch is known as posterior interosseous nerve, and this posterior interosseous nerve does not supply any skin area. It is purely most of the muscles of the back of the forearm supplied by the posterior interosseous nerve, and it terminates after supplying the wrist joint. So my dear students, this is the important concept, that this superficial branch has no muscular branch, and this deep branch is having no cutaneous branch. Clear? So this is the important concept which you have to keep in mind, because it is a very commonly asked question, that posterior cutaneous nerve of arm is a branch of. So it is not a branch of posterior interosseous nerve, it is a direct branch of the radial nerve which we have seen. Clear? So what is the a brief about the superficial branch? That it passes down in the lateral side of the anterior compartment of the forearm. So when you have seen that there is a termination into the superficial and the deep branch of the radial nerve, this superficial branch is running in the anterior compartment of your forearm. But while running in this anterior compartment, it run on the lateral side of the anterior compartment and in the proximal 2/3 of the forearm. That means if you will divide this forearm in the lower 1/3 and the upper 2/3, what you will realize that it is lies deep to the brachioradialis. So when you are doing the dissection and once you will lift the brachioradialis on the lateral border of your forearm, you will find below that a nerve is running, and that nerve is your superficial branch of radial nerve. Some students are having this confusion that, sir, it is a superficial branch, but it is not running in the skin, it is running deep to the brachioradialis. My dear students, it becomes superficial lower in the arm, in the forearm, not in the upper part. It is going to become superficial at the end of its termination in the lower part of your forearm. So this is the superficial branch, and the deep branch remains deep throughout the course. It never comes out below the skin. So the superficial branch initially remains deep to which muscle? Brachioradialis. And while it runs on the lateral border deep to the brachioradialis, it crosses three muscles. From above downward, first it crosses the supinator, then it crosses the pronator teres, and finally it lies on the flexor pollicis longus. So it runs deep to these brachioradialis on these three muscles, and the radial artery also run along with the nerve on medial side. Clear? Around 5 cm above. That means at the junction of the lower 1/3 and upper 2/3 of your forearm, the superficial branch of the radial nerve now take a turn. Now once it is taking a turn, it lies deep to the tendon of brachioradialis. So this is the important thing which you have to keep in mind, that when the nerve is taking a turn along the lateral border of your radius, it lies deep to the brachioradialis, and then it descends to supply the dorsum of the hand, and it also supply the posterior aspect of 3½ digits. So what you are able to understand here? You are able to understand here that it is a superficial branch. That means it has to enter into the skin. That's why it is superficial. The second thing is that in the initial course, it is not superficial. It lies deep to the brachioradialis muscle, and it runs along the lateral border of the forearm in anterior compartment where it crosses the three muscles. One is supinator, then pronator teres and flexor pollicis longus, and it is going to supply the dorsum. And how it supply? It has to cross the lateral border, and when it is crossing the lateral border, it lies deep to the tendon of brachioradialis. So in this video clip, now here you can see that this is your brachioradialis muscle. And here you can see that the tendon is there. Now, if you remove the brachioradialis, you are able to see the whole course of superficial branch of radial nerve. Now, this superficial branch of radial nerve first running on the supinator muscle, then it is crossing the insertion of pronator teres, then it is crossing the flexor pollicis longus, and then it is taking a turn. Now, while it is taking a turn, it was deep to the tendon of brachioradialis, and then it ultimately enters into this area where it is supplying the skin over the anatomical snuff box, and also it supplies the dorsal surface of 3½ fingers. What about the deep branch? The deep branch is also known as posterior interosseous nerve. The deep branch enters posteriorly by passing through the supinator. Now, my dear students, this is a very important question for your exam, that how this branch enters in the posterior compartment, because some students having the confusion that posterior branch passing through the upper border of interosseous membrane and then it comes in the posterior compartment. No, posterior interosseous nerve enters into the posterior compartment by piercing or passing through the supinator muscle. And when it enters into the posterior compartment, here it supplies all the remaining muscles of the posterior compartment of forearm. It ends in a pseudoganglia. Now see, here again you have a word pseudoganglia. Now pseudoganglia, I already explained you in my class of axillary nerve. So axillary nerve terminates as a pseudoganglia when it is supplying the teres minor. Here the posterior interosseous nerve terminates in a pseudoganglia, and ultimately the pseudoganglia gives the branches which are supplying your joints, that is your wrist joint and the small joints on the posterior side. Now there is one very important question, that sometimes what will happen, that while passing through the supinator, this now will get compressed here. Now this border of the supinator is known as supinator arch. So here you can see that this is the deep branch. This deep branch is first passing deep to this point of the supinator, and then it come out between these two heads here in the posterior compartment. Now this supinator arch is known as arcade of Frohse. So this is a very important question. What is arcade of Frohse? Arcade of Frohse is nothing but it is a proximal edge. So it is a proximal edge of this supinator muscle, and this supinator muscle edge sometimes compresses the posterior interosseous nerve. So this nerve is compressed by the upper proximal border, and that is known as arcade of Frohse or supinator arch. Clear? So here in this video clip you can see how the posterior interosseous nerve enters in the posterior compartment. So here you can see that it is passing through this upper margin of the supinator, and then it is coming out in the posterior compartment between the two heads of supinator muscle. Clear? So we have seen that the radial nerve is dividing into the two branch, superficial branch and the deep branch. The deep branch is going behind by passing through this arch, or you can say the arch of Frohse, and then it enters into the posterior compartment at this point where you have the entry between the two heads of supinator. So my dear students, at the end of the session of radial nerve, what we are able to understand, that the origin of radial nerve is actually a continuation as a posterior cord. The origin is behind the third part of axillary artery. It leaves the axilla through the lower triangular space, then it runs in the posterior side of the humerus in the radial groove, then it pierces your lateral intermuscular septum to enters into the anterior compartment, and then it terminates into the two division. The anterior division is the cutaneous branch, that is superficial branch, and the posterior division is the deep or the posterior interosseous nerve, which mainly supply the muscles of the posterior compartment. So this is all for the today's session. Thank you.